Hey, welcome everybody. We're just going to give it a few more seconds for people to join and then we will get started. Okay, well, welcome everyone. Thank you all for attending today's webinar, Connecting Private Sector Data with Environmental Public Health Agencies. And this is brought to you today by NEHA's Informatics Committee. So before we get started, just want to give you a little introduction on myself and who NEHA is. So my name is Becky Labo, and I'm the Senior Evaluation Specialist for the National Environmental Health Association. So as an association, everything we do is to build, sustain, and empower environmental health professionals so that they are equipped and prepared to protect the health of communities across the country. So while many don't recognize it, environmental health is the foundation of public health. Environmental health refers to protecting humans from health risks that come from the environment, such as pollution in the air, contamination of food at a restaurant, or lead in a water source. So if you aren't already, you might consider becoming a NEHA member. NEHA members not only support learning opportunities like this one, but you will gain access to exclusive environmental health trainings, access to our online community network, access to credentials to highlight your expertise, and an annual subscription to the Journal of Environmental Health. You will also get access to newly developed practice resources and reduced rates to our annual educational conference and exhibition, books and courses. So if you're interested in learning more about being a member, you can find more details at our website at neha.org. So this is the agenda that we're going to follow today during our webinar. I'm going to give you a little background about the Informatics Committee. I'm going to introduce our guest speaker, and then she will give her presentation, and we'll have some time for Q&A. And then I will introduce our moderator and guest panelists, and then we'll have a panel discussion, an opportunity for Q&A. So before we get started, I just want to cover a few housekeeping items. So please note that the webinar is being recorded and will be uploaded onto the NEHA Informatics Committee webpage. And then please use the Q&A to submit any questions for the speaker after her presentation, as well as during the panel discussion. You can find the button to open the Q&A at the bottom of your screen. And then as a reminder, at the conclusion of the webinar, you will receive a link to take part in an evaluation survey to provide feedback and comments on today's webinar. So the mission of NEHA's Informatics Committee is to be a resource for environmental health professionals and leadership dedicated to developing informatic resources and programs, increasing workforce capacity, and fostering improved data utilization to protect environmental public health. Our Informatics Committee is comprised of public and private sector experts working in partnership to provide outcomes in the following areas. We work to identify and make recommendations related to training gaps, needs of the profession, and emerging issues. We identify best practices and successes and opportunities for data utilization and informatics. And we participate in the development and improvement of NEHA's informatics program by providing subject matter expertise, support, and guidance. And we also promote and disseminate informatic-related materials and resources. So our committee is comprised of local, state, federal, and industry professionals with environmental public health, informatics, and data expertise. So again, if you're interested in learning more about joining our Informatics Committee, you can reach us by email at support@neha.org. So why is data important to our field? NEHA believes that adopting the use of informatics and reliable data is a central pillar to decisions in environmental public health, academia, and industry. Data collected can make an impact on core functions that impact environmental public health, including the fields such as food safety and sanitation, water safety, aquatic facilities, on-site wastewater, climate change, air quality, wildfires, and vector control measures, just to name a few. So this webinar will focus on environmental health data collected in the private sector, as well as at state, local, tribal, and territorial health departments. And we will discuss how these environmental health data and research can and should be connected better to be able to impact policy and practice, and how it can be used to identify emerging issues and needs to better protect environmental public health at state, local, tribal, and territorial areas across the nation. So with that, I would like to introduce our guest speaker today. Our guest speaker today is Shelley Wallingford, the Director of Food Safety for First Watch Restaurants. Shelley has over 25 years of experience in regulatory, food safety, and epidemiology within the food service industry. She has a bachelor's degree from California State University of San Bernardino in environmental health, a master's in organizational leadership with a concentration in change management from CSU Global Campus, and she is a registered environmental health specialist. Over the course of her career, she has been responsible for all restaurant-level food safety management systems, regulatory compliance, and oversight of third-party vendors and key partnership services. She is an active member of a variety of industry committees and technical advisory boards, as she desires to stay in the forefront of emerging trends, latest science, and any regulatory changes that may impact food safety. She is passionate about preventing food-related incidents and ensuring a positive guest experience. Shelley is also an avid lover of the great outdoors and believes we are all better together. A favorite quote of hers by Albert Einstein: "You can't solve problems with the same thinking that caused them." So thank you, Shelley, for being here with us today, and I will hand it over to you.
Awesome, thank you. So with that being said, I'm going to share my screen. There we go. Oops, looks like oh, all right. I think I did it correct. Okay, so thanks for that great introduction, and I'm really excited to talk about data sharing and how we can all use data. We all collect data, so how we can all use it better between industry, academia, regulatory agencies. So with that being said, what I'm kind of going to go over briefly is restaurant data. So the restaurants collect a myriad of different data points. Some regulatory data. I'm not going to necessarily cover all the regulatory data, but really the regulatory data that potentially is meaningful to the restaurants, and then how we can share data better. So with that being said, the regulatory data that the food establishment data that we really look at the restaurant is our food safety data. So with that, we've got third-party assessments. So lots of restaurant chains and even some small and pop organizations will use third-party assessments to assess how they're doing in food safety. Sometimes they'll also use those assessments to look at operations excellence, so how they're executing on their brand standards. They might even look at workplace safety. So these third-party assessments can gather a lot of data to help teams really understand, are their policies and procedures driving the results that they want. Another food safety data set that a lot of organizations use are self-assessments. Self-assessments, I'm sure a lot of you are aware, is really at the operator level, understanding do they understand the policies and procedures? How well are they equipped to identify gaps in their own systems and routines? Do they know how to get the restaurant back to standard if things have gone wrong? Kind of that active managerial control piece. So a lot of quality assurance folks will look at that data to try to determine how well we're able to actively manage the restaurants when we get out of standard, because obviously in a restaurant you're never going to be perfect all the time. So how do you identify those gaps and get back to standard quickly? Another set of data that kind of gets overlooked is performance data. And then when I was at the NEHA conference recently, there was some industry folks and they talked about KPIs, and somebody asked what a KPI is. And so KPIs are used in industry a lot, and it's key performance indicators. And so it's data that they look at to determine, are we achieving the right results? Are the strategies and things that they've put in place moving the needle in the right direction? And so a lot of data is gathered on things like sales and turnover and training completion and ticket times and average ticket sales, and all of that data is used to help operations determine where their gaps are and what they need to do, and are the strategies working. One good thing about key performance indicator data is if you understand what the company is looking at, what's driving their motivation, you can sometimes tie food safety data to that. So really understanding KPIs, what they're looking at, what they're measuring. Because the other thing can happen is when you're looking at KPIs, how you're measuring that can also potentially have unintended consequences. So if you're just measuring to make sure that the self-assessment got done, then the self-assessment got done and everything's in compliance and everything's at the right temperature, and golly gee, nothing ever went wrong, right? But if you're actually looking at the self-assessments and you're really looking to make sure that there are gaps in procedures, that there are, and then how are we fixing those, it really can drive results in a different direction. I have on the screen here like an example of a third-party assessment, and then electronic fusion prep is used with some restaurants to gather data as relates to temperature checks and maybe some other self-assessments in the restaurants. And when you do it electronically, you can get better data to identify trends and gaps. A lot of restaurants are still using paper, which then makes that challenging. And then the last set of data that restaurants usually will look at pretty closely is their customer data. So that's going to be like customer complaints, talking about the food being cold, hair in food, server being mean. But then there's also customer satisfaction surveys, and a lot of restaurants will survey their customers to try to understand what do they think about the guest experience. How would they rate that? And a lot of times that's another KPI that restaurants will hold their leaders to, improving that customer satisfaction score. So that's another way to kind of look at how well the restaurants are being managed and what do our customers think about the experience. So next, you've got all your regulatory data. So as a restaurant operator, you're going to get inspection data. You may get some illness data. We do sometimes get complaint inspections, but the data that we get from those complaints can sometimes be challenging. As regulators, you've got to be careful what data you share from a complaint because it needs to be anonymous, but you still need to be able to investigate the complaint. Illness data can really also help the operators understand if there's a problem in the restaurant or if it's a problem in the community. And unfortunately, those two data points we don't get a lot of data on. Where we tend to get most of our data from the health departments is that inspection data. And you can get it electronically, you can get it on paper reports. And there can be some really great data in there that we use to help augment all the other data that I just talked about on ensuring that we're having great customer experiences. We're not making anybody sick. We're meeting regulatory compliance issues. But as you can see, even just from this picture here, there's just 3 and they look very different, right? So that can be a challenge. So with that being said, I'm going to move into what's working and what can we improve. So as it relates to what's working, obviously everyone values data. Lots of folks are collecting data. Regulatory is collecting data when they're doing their inspections or disease investigations or complaints. Even academia is collecting data on what are the drivers of foodborne illness and how are we driving that down. And FDA is collecting data. Industry is collecting data as it relates to all the things I just talked about. So there's lots of data out there. And some of that data is being used really well to improve outcomes. Some of it's just sitting out there not being used. Some of it, sometimes you get data fatigue and you get so much data, you don't know what to actually do with it, or does it mean anything? Some people get too far in the weeds. So how do you identify trends? How do you really analyze the data to really make it useful so that you can actually do something with that data? So what can we improve? So I'm going to have a little bit of an industry lens on here. So unfortunately, a lot of the data that we're getting from health departments, it's on different forms. They're on different food code versions, potentially. They're not doing them on the same frequency, so it makes it really hard to hold restaurants accountable if there are health department issues because the frequencies don't match up. How do you, also work on potential differences between inspectors, right? So some inspectors are going to be very detail oriented, some maybe not so much. So that is that calibration or consistency from inspector to inspector. We also see that in our third-party audit data. The issue is with third-party audit data, it's much easier for us as a quality assurance team to hold them accountable to making sure everyone's calibrated, because we have a set standard on what we want them to look at. We can reach out and say, hey, I don't think this person evaluated this properly. We have feedback loops, and then they will evaluate whether or not it was evaluated to the right standard. And if it wasn't, they'll modify the assessment and resend out a score or the findings. And so then we have an avenue to kind of get things corrected. Health department inspections, it's not so easy to do that. So, I'll reach out to health departments and say, hey, I think this might not have been assessed correctly. A perfect example is all of our eggs are pasteurized, and we get lots of violations around handling raw eggs and not washing hands, but our eggs are pasteurized, so they're not raw. Or we'll get violations that our menus need to have undercooked eggs on there, same thing. And so getting those violations off the health department inspections can be challenging because they don't always have a mechanism to go back and modify or change an official report. Then it's in the file, and then, it shows up again on another inspection. So those are just some of the things that I think we can improve on, but then also, how do we share data better, right? So the industry has a lot of data, but it's hard to share that data with regulatory, because how is that data then going to be used, right? So if we're sharing our third-party assessments with the health department, how is that going to be used? A lot of regulators or a lot of folks in industry are worried that that data might be used to do, aha, I caught you, right? Like, oh, I know that you have an issue with, not cooking your, I don't know, prime rib to the right temperature. And so now I'm going to go in with a laser focus and check on that. I know that nobody wants to do that. We all want to work together to drive better outcomes and ensure that our communities are healthy. But that's the reality of how, unfortunately, some operators are worried that that's going to happen, right? So how do we put that at ease? I know there's been some discussion about sharing third-party assessments and then potentially not doing as many inspections at that restaurant. But then sometimes regulators are worried that if, is the third-party assessment really doing a good assessment? Are they looking at all the food safety things? Can I really not do an inspection based on data that we receive from a third-party assessment. So those are all challenges, but they could really help us if we look and figure out ways to share that data that can really help us look at larger trends, maybe not just trends at a certain restaurant, but food safety trends in general, so that we can really start looking at the things that we're putting in place and are they really driving the results that we want. So that's really all I had planned to share. Hopefully I put some ideas and thoughts in everyone's head as it relates to all the different data that's out there, how we could potentially share data better, what are some of the gaps, which I'm sure a lot of you are aware of, but maybe I sparked some ideas out there.
Thank you so much, Shelley. So we have some time for questions. If anybody has any questions for Shelley, you can put them in the Q&A box.
Becky, we do have one question for Shelley in the Q&A.
Okay. Shelley, someone is asking, are you scrapping the data from public sites or getting machine readable data to analyze?
Oh, that's a great question. So at the company that I work at, we were using a third-party audit company to collect data for us. And we had a policy where the restaurants were supposed to submit their third-party health department inspections to the third party. Then they would normalize the data, but unfortunately we found that our restaurants weren't always great about submitting the health inspection reports, especially if they didn't do well. Or they would wait until they had the follow-up and then they would only submit the follow-up, or they'd wait till they had the follow-up and then they'd submit both because they wanted to show that they were already in compliance. But then if they did bad on the follow-up, we weren't able to help them because we didn't know that they had an inspection in the first place. So we have now moved to another company that is just doing health department data for us, and they go out and mine data at all of the health departments that upload them electronically. And we are already seeing much better success with that data. The way they're normalizing the data is much easier for us to identify trends and gaps. We've already put some things in place to try to help with some gaps that we identified, one of which is not being able to talk to regulators about the fact that our eggs are pasteurized. So we put together what's called the Health Department Readiness Binder that has all of our standard SSOPs so that they could just hand it to the regulator, because they freak out, unfortunately, when an inspector walks in and their brains turn to mush. So thank you for the great question.
Perfect. We have another one. Shelley, do you think that the way the food inspection report is entered is important to capture your data versus just comment area with open text? So for example, if selecting a foodborne illness followed by in and out violations and corrections.
So, that's a great question, and I'm sure you can make arguments for both sides. I personally like the more you can standardize the data, the better you can find trends and gaps. However, open fields for comments, you can also kind of capture things that you're just like, oh, I didn't think of that, right? So I personally like the blending. I like trying to capture as much data in a normalized format so that you can do some analysis on it, but still allowing for those comments so that you don't miss some of those unique opportunities or things that might come up, or maybe you just need more clarification as to why you marked that. So I hopefully that answered the question.
Thank you, Shelley. We have another one. What are considerations for spatial or location-specific data in analyzing and presenting this at various jurisdictional scales?
I am not sure I understand that question. I think they're asking about like geographic type results. So we're not unfortunately, my organization is pretty much heavily in Florida. We are in 29 states. So most of our locations are in Florida, but we are trying to get more into geographic data. We are trying to do heat mapping to try to understand if we're having different types of violations based on temperature patterns. So for example, in Arizona, we tend to see more violations around the water that we wash our fruits and vegetables. It's hot, it's supposed to be cold, but the lines are never cold in Arizona. So it's causing our fruits and vegetables to warm up faster than we had anticipated because the water is starting off much warmer. So we are trying to look into some geographic data. And where I say it could be really helpful is getting more data as it relates to when health departments come in to do inspections for, let's say, a disease investigation or a complaint. A lot of times what we get is there was a complaint and then we're just seeing the results of what I would consider a routine inspection and not really more targeted data.
Thank you, Shelley. We have one more question before we will move on to the panel. Regulatory inspections data is fragmented and held in different public agency portals. Is there a unifying or integrated repository combining all this data to check trends historically?
As far as I know, there isn't, but that would be amazing. Right? I mean, that's what I would love to see is us working towards having some kind of standardized way to collect this data so that we're better able to not only look at trends and issues from health department to health department, but from state to state, and really kind of help us try to drive down those things that are when I say out of control, meaning like they're either not being managed well at the restaurant, and helping us to really come up with some mitigating, tactics that can really work to start seeing some results and driving some change as it relates to food safety, culture, and behavior.
Okay. Thank you so much, Shelley.
Yeah, thank you.
To keep us moving, we're going to move on to our introductions for the panelists. If you have questions that you still have that weren't answered, please save them and we can try to address them during our panelist discussion. So next, allow me to introduce our guest panelists. First, we have Nick McMillan, who is a managing partner for Golden Steer Steakhouse in Las Vegas, Nevada. Before moving to Vegas to run the Golden Steers, Nick spent 15 years building mission-critical software systems. After graduating with a degree in computer science, he joined Motorola to build government radio communication systems for customers such as the FBI, DOJ, and armed forces. He then went on to become a co-founder and CTO of Akuba. Akuba is a private labeled cloud lending platform that digitizes and automates business lending for financial institutions. Akuba was sold to Velocity Solutions in 2018. Nick and his wife Amanda moved to Vegas in 2019 to take over the Golden Steer Steakhouse and has built its own proprietary software solution to integrate disparate data sources and provide business intelligence solutions. Next, we have Scott Bierman, Vice President of Government Affairs for the Georgia Restaurant Association. Scott has been with the Georgia Restaurant Association since 2022, where he has worked to ensure a streamlined and open line of communication between government agencies and restaurants. The GRA has a long-standing history of working closely with government agencies such as the Georgia Department of Health and the Department of Agriculture to ensure food safety is and continues to be at the top of mind for the industry. And our final panelist is Michael Crea. Michael was the executive director for the Florida Environmental Health Association and is the owner of Z-Edge Tattoo and Piercing in Sarasota, Florida. He holds 2 associate degrees in graphic design, a bachelor's degree in environmental science, a master's degree in environmental technology and management, and a graduate certificate in infection control from USF. He's the executive director and past president of the Florida Environmental Health Association. He has been a guest speaker at multiple events, educating the industry on safe and sterile body piercing procedures. And he also served on NEHA's Body Art Model Code Committee. So I want to thank you all for your time and willingness to be part of today's panel discussion. And next, I would like to introduce our moderator. Today's moderator, she is a member of our informatics committee, sorry. And her name is Serene Ong, and she's a GIS analyst with over 20 years of applied GIS experience, currently working at San Bernardino County's Department of Public Health. She specializes in spatial data analysis, mapping solutions, data visualizations, and mobile field data collection applications to provide support to all divisions and programs in the department. As a data analyst, her role is to transform complex data and present it in accessible formats to inform public health policy and response. Her goal is to use geospatial technology to advance health equity and improve the delivery of health services across the country. So with that, I'm going to pass it over to Serene, and then I would like to invite the audience to engage with today's panel and just remind everybody again to use that Q&A box. So Serene, it's your floor.
Great. Thank you so much, Becky. And welcome panelists, Shelley, Nick, Scott, and Michael. Thank you for being in today's panel discussion on connecting private sector data with environmental public health agencies. We have a great group with a lot of great industry knowledge here, and I'll call on each one of you for questions, but panelists, please feel free to respond to each other's comments and insights, because we're here to explore this subject that impacts in many ways. And our goal is to engage, challenge, and inspire each other. So Shelley has covered some of the questions actually below, but for the sake of discussion, we'll go over them still. And with that, let me start off with our first question. This one is for Scott. Does your company use inspection data generated by a local government? How do you access that information and for purposes?
Oh, thanks, Serena. I appreciate it. And thanks everyone for having me today. So at the Restaurant Association here in Georgia, we aren't necessarily diving into that data every day like a restaurant would, like an operator would. What we do with that is just kind of look at it big picture wise. How can we communicate that to our operators, to our members, to let them know kind of what are the trends. Shelley mentioned trends a minute ago, and that really stood out to me. Are we talking about trends? What are we seeing across the board? What are we seeing when our inspection data comes back? And how can we better prepare our folks to handle those issues as they pop up? In Georgia, we have a fantastic online system. You can go in and find a lot of this data, a lot of the specific, inspection reports and stuff that we can pull out that we can point to and direct our members to take a look at and say, hey, this is what we're seeing. Here's some examples of that. Be sure to be on the lookout for that when you move forward.
Great. Does anybody else have anything they want to add to this?
Scott, I would just add, I think that's a great point. And I think that one of the challenges that Shelley talked about a little bit too was kind of the normalization and standardizing of that data. I'm sure even in Georgia, each of the jurisdictions are or maybe it's all the same report, but maybe are using slightly different reports. And so it can be sometimes challenging or a very manual process to pull that data out. And so I think that's a great kind of jumping point for kind of the standardization conversation, because if it were able to be standardized across a given state, let's say, the ability to pull out some of those insights could be automated in some fashion to kind of make that cheaper and easier for everyone. In addition to, I think the other piece, not just on the inspection side, but I think there's a lot under the umbrella of what inspectors are coming in and looking at. And so maybe there's going to be a renewed focus in a given year on a certain area. And so maybe that can get picked up in the data as well to help make sure that operators are prepared for any new renewed focus in a given year.
Great, thank you very much, Nick and Scott. Next, I have a question for Michael. In a body art facility, what kind of environmental health data does your company generate? And what of that is shared with the Department of Health? And do you perform internal audits?
So we generate basically sterilization data. So we'll keep logs of how many times we run our autoclave, what's in there, how often we run spore tests. So we mainly utilize the sterilization data. That information goes to the health department during inspection. They don't capture all of the data. They just capture the last spore test done or the last maintenance done on the equipment. But they don't capture all of the data from all of the equipment that we've used.
Great, thank you, Nick. This next one is for Shelley. I'm sorry. Thank you, Michael. This next one is actually for Nick. What kinds of data do you think your industry should share with environmental health agencies?
That is an excellent question. I think it's an excellent question, and I think the answer in pure public health is, as much as possible. I think the very real concern, and I'm sure there's cases of it, but the very real concern Shelley raised earlier, right, is if we are sharing some of this data, is it going to have a very adverse impact, right? And of course, for extreme examples, no hot water, some of the more clear-cut cases, then I think that those are separate. But I think there's certainly a hesitancy to, we have a third-party inspector that probably comes in twice a quarter and does his, their own reports that we keep internally. And we, it's been a discussion. Is it something that should be shared? And I think there's, those are the discussions we have, what's going to happen with this data once it kind of reaches beyond the walls of the restaurant. And so we use it aggressively internally to ensure that we're, tracking towards what we need to. The Nevada just went through a big set of changes to its health code this year. So it was instrumental, especially in cases like that, it's instrumental to understanding, how those changes come through. And so, and what, is going to be kind of the focal area for those pieces. So, I think as much as practically possible, right? I think an example that I like to come up with is temperature monitoring of coolers and freezers, right? I think that's if the right protections are in place, or an incentive structure to say, hey, if you're gonna provide even anonymous real-time measuring of your freezers and coolers, we might be able to improve health outcomes, right? So, which I just think is good for operators to do, notwithstanding anything else. So, it's a great question. I think there should be a lot. And Shelley, I don't know if there's anything. I'm sure there's a bunch more that you have to add on that piece. Not to throw you out there, but I'm sure you've seen a lot with that question.
Would you like me to respond?
Yes, please.
Okay. Yeah, I mean, I think the remote monitoring of refrigeration is a great one. We're looking to do that as well, but then that also becomes challenging too. Like I get notified every time the refrigerator is, out of temperature like 1 degree, and then it becomes noise, and then you don't look at it, right? And then when it finally is a big issue, like no one's looked at it, right? So it's finding that balance of like, what do you share? What's actually going to be helpful? And then how do we use that data collectively as a group to identify, ways forward? Another thing that somebody had asked in the chat was about, truck refrigeration temperatures for deliveries, right? And I remember as a regulator, man, that was a big thing. Like I would sometimes be at a restaurant when food was being dropped off and it's already at a temperature before it even gets into the restaurant. Or, when I worked at Starbucks, I actually followed a truck around, and the temperature gauge when it was delivered said it was fine, but it had been out of temperature and been temperature abused multiple times throughout the delivery based on where the food was placed on the truck, right? So there's lots of data out there. We just need to all kind of like sit down and be like, what can we share and how can we all use that data together to try to come up with some strategies to help, right? So I think a great thing to do would be to sit together as a group and maybe come up with 1 or 2 data points that we all agree to share, and then see like, can we make a difference with this, right? Pick something easy, some low-hanging fruit, right? Hand washing is another one where we all see lots of violations on hand washing. I talk about hand washing all the time, and yet like it's not improving, right? Like, what can we do to improve hand washing, right? How do we collect data and tell a story that really helps move the needle for everybody, right? I don't know that I had a solution, but thanks for asking.
Yeah, good points. And again, Shelley, this one is for you now. So we've heard about, what we think industry should share with environmental health agencies. So now in what capacity would you like to see environmental health agencies share their data with the public? And what kinds of data, in your opinion, should not be shared with the public?
That's a hard one. So I definitely think the public needs this data, right? They need to make informed decisions, but with the inconsistencies on how the frequency, we're not all on the same food code, the public's lack of understanding of what's really a risk. So they might get really freaked out about hair in food, but is that really going to make somebody sick? Or they'll see the number of violations and not necessarily understand the difference in severity between some half and half milk being at 45 degrees versus cantaloupe being at 60, right? So part of it is just, how do we better educate the public on what truly is a risk and what do you really need to be focused on? We give them so much data that they don't really know what to focus on. And I think that happens at the restaurant level too, right? Like if we can get more laser focused on what we're actually trying to drive a change in, we might actually be able to make a better impact. So, but I definitely think we need to share restaurant data, inspection data, electronically, if we could make it more consistent. So we're comparing apples to apples, because here's the thing, consumers also don't just eat in their local communities anymore, right? So if I'm living in Orange County, California, and I go to a restaurant and I look up their health inspection data, but then I'm on vacation in Florida and I look up that data, I now don't understand what I'm looking at because it's not comparable. So we want the community that we're trying to help serve be educated about what they're eating, but we're not even giving them that information in a way that they can understand it from restaurant to restaurant.
Mm-hmm. So there needs to be some kind of consistency across the board, as well as picking strategically the right types of data to share. Right?
That's my feeling. Yeah.
Great.
And I'll jump in there too. I mean, what we've seen from the industry in our state as a whole, you don't want to overload folks with too much data. Kind of to Shelley's point, you give them a letter grade and you give them a number and you give them all the data. At a certain point, to something that Shelley said in the previous question, it becomes noise. You just you tune it out. A 95 and a 98 or a 100 are just very different. They could be very different things, or they could be the same, and you just you drive on by and you walk in the door and it doesn't matter. So I don't want to overload folks with that. We also don't want to punish restaurants for making these steps and trying to improve, and maybe coming up where they're 1 or 2 things that bump them down, where all of a sudden that it's a 95, but maybe not to the point about the hair in the food, maybe not a huge 95, maybe it's just a small issue. Or in some states I've seen, you travel around, you see what's going on in different areas, you see letter grades but no numerical grade. What does that mean? Is it 100? Is it a 90? Those are both A's. So kind of getting some uniformity there would be helpful for our folks. Now, look, we're in one state, but we have major brands that are in our state too, and they would be fantastic to come in and tell you, yeah, in Georgia we do this, in Maine we do this, in California we do this, and there are complete differences there. There's a lot there, but digitally. Everything's on everybody's phone now. We all know that, right? You can order a cheeseburger to your house and it'll be there in 20 minutes just from your phone. You have to get it from the couch. Data is everywhere. Data is on there. Having it accessible that way, again, double-edged sword though. When does it become too much and when is it actually informative? And I think that's something as a group and as an industry, both from the restaurant side and from the departments of health and on that side, how do we narrow that in so it's getting the point across?
Yeah, exactly.
So I can come at that from like a body art perspective. We don't have any inspection data other than pass or fail available to the general public. When they do, and this is in Florida, I don't know about the rest of the country, but when they do the inspections here in Florida, all your violations are all write-in, they're all fill in the box. So there's no real way of capturing all of that data for the violations, except somebody sitting there physically going through each inspection sheet and maybe making a spreadsheet or something out of it. But there's nothing automatic that is captured here in Florida except pass or fail. So when you look up some kind of data on the website for that, on the health department's website, that's all you see. You don't see why they failed. They could have failed for something stupid, or they could have failed for something major, but you don't really know. So that's kind of a problem right there. But then also, if you give the public this information about what's on their inspection report, they don't know how to read that. Food is a little easier. People can understand, okay, this food was at 90 degrees. It should have been at 30. That's easy to understand. Whereas like some body art stuff is a little bit harder to understand and people might interpret it the wrong way. So maybe that's, why they don't have all that data available. And then to kind of backtrack to the third question we were talking about, like what should we share with the agencies? It's been a big problem with adverse reactions data being shared. Now, like we need to know if there's a problem with a product. Like the whole industry needs to know, but how do we know? Like right now, the only way for us to report something is through MedWatch. And even that, like people they don't know how to use it. They think that somebody's going to come in and shut them down because they had an adverse reaction with something that might not have been their fault. But that's a real big, hot topic right now in the body art industry is problems with tattoo ink or problems with one product, this product, that product. And there's no real way to capture all of that adverse reaction data and give it to somebody and then merge it all together with the rest of the country. Right now, we're just relying on people to maybe make a phone call and call the manufacturer up and say, hey, I had this problem. But then you're relying on the manufacturer then to go tell somebody. And that's, it just doesn't happen a lot of the times unless the FDA gets involved and there's like a huge outbreak going on, then we do investigation and track it back. But it's often too late. By that time, thousands of people have been exposed to, a bad product or contaminated product when it could have been stopped in its tracks, long before that, had we had some kind of a system where people can go in there and the word I'm looking for, they don't have to tell them their names or anything, when they're putting all the data in anonymously. I'm sorry, they can put all data in anonymously, so they don't have to worry about repercussions from the health department. And that's a big problem too. Like if you share too much data, are you going to be afraid that the health department's going to come in and shut you down? And there's a lot of distrust in our industry trying to tell regulators, about all that, about problems we have, because then they're required by law to come in within 72 hours if you report a problem and do an inspection. And if they find that it's worth to shut you down, then they can shut you down for it. And what I've found, it's a lot easier to shut down a tattoo shop and a body piercing shop than it is to shut down a food establishment. Speaking from experience, I have a restaurant next to me in one of my stores that is an absolute disaster. I mean, it's disgusting. Wouldn't even want my kids to step foot in front of it for fear of catching something. And yet we can't get the guy shut down because of all these other little things. They won't come in, they don't want to do their job. And that's a problem too. So, we have all these things that add up. And basically a place that if we had a place that we'd be able to go and report reactions and report different things without fear of repercussions, I think that would go a long way in this industry.
Thank you, Nick.
Serene, we have a follow-up question that I think is good to ask right now based on this. This is for all of you. Do you have any recommendations to strengthen the relationships between industry and local and state agencies around sharing data and understanding data? How might we be able to strengthen those relationships?
I think in Georgia, one thing we've really done, we have a great relationship with our Department of Public Health here. One thing that we do as an association is we kind of act as the go-between from the restaurants and the departments of health. That way, if there's a question they're afraid of kind of getting, a surprise inspection or a tap on the wrist or something, we can go in and kind of ask some questions and be that mouthpiece, if you will. So folks can feel free to answer questions. And we also have a good Department of Health here. I don't know if they're on the call, so I'm gonna give them a shout out. They're great. They see themselves not as as an attack dog or a watchdog. They see themselves as partners and an education agency to educate our folks as well. And I think that's really built a really strong relationship here. Is it perfect? No. I mean, every restaurateur in the state is going to have different feelings. And I'm sure departments of public health across the state are going to have different feelings. But just those two things, like the mindsets of coming from DPH to our folks as this educator, it kind of opened our guys' eyes into, hey, they're not adversaries, they're friends, but also having someone like us who can be that go-between to help answer some tough questions there, and make it a little easier sometimes to get what you need to know.
And I would add that these types of forums definitely help in any opportunity where folks can spend time with their counterparts, right? And talk about the challenges. And, some of the stuff we talked about is hard, but the ability to even just go into a restaurant and shadow like a quality assurance person and just kind of see, like, how are we talking about quality assurance issues? So when I went from regulatory to industry, I really thought I knew how to talk to operators. And then I was like, wow, I am speaking a different language, right? And so really understanding, like when you come in as a regulator and you're asking different questions, they're already kind of in a state of fear. And so how do we put them at ease? How do we work with our quality assurance partners to really understand maybe the culture of that restaurant, maybe the language? So some of the language is going to be different. Like, how do we tie it to things that they really understand, and start, creating that balance between regulating, because you still have to regulate, right? You still have to hold us accountable if we're not doing what we're supposed to do, right? To Michael's point, like, we can't be making people sick, right? But on the same token, how do we come at it with that layered approach, really understanding that this person might be kind of scared of us, understanding maybe there might be some language challenges or differences or different focus, and really just spending time with some other folks that maybe have a different viewpoint, to maybe help you see a different way to come at it.
Those are great points. Building good relationships and, spending time and your approach to the operators really matters, right? I'll move on to the next question. And this is for Nick. What do you see as the future of environmental health data used in your organization?
So for us, I think fortunate to have kind of a background in the software and data space, and so and it's paired with an old school restaurant, so it's kind of an interesting juxtaposition. But one of the things that we are trying to do, that I've been trying to do, is view it kind of as the restaurant, and specifically the kitchen, as a little bit of a software system where I need to see the data from it, right? I need to see the temperatures of my walk-ins. I need to see the temperature of the food on my line. I need to, ensure that we have tankless water heaters, that they're putting out what they're programmed to do, right? And so we have begun the process. We still got some ways to go, but we've at least begun the process of, one, just capturing that data, right? Digitally, so that it's not just on paper, so that we can capture it in some way, so that we can react as aggressively as we need to. You know, if a cooler does go down, well, how long do we think it's going to be down? When did HVAC get dispatched? And you know, how long are they going to be there? Do we need to spin up any contingency plans? So that's been our, you know, perspective, is how do we start to all of that data is already existing, we're just not measuring it. So how do we start to measure it digitally, collect it, and then do it in such a way that we can act on it? One, you know, to be better reactively, but then ideally to be better proactively, so that we can track when was the last time our compressor was serviced, so that, you know, maybe if it was a year ago, if I have data for 3 years and every year, you know, every 8 months it seems to break, well, then month 7, I want to get someone out to fix it, right? And so I can be a little more proactive. So that's at least a little bit of how we've started to think about it.
Yeah, great. So it's technology helping you to track things, right? Yeah, and being proactive on things. Great. So we've got about 5 minutes left. Oh, actually, no, we have about two and a half minutes left. So let me ask one more question. And this is for Shelley. With over 2,800 distinct environmental health operations in the US, how would you address the variety of records required, like permits and inspections across jurisdictions?
I'm not sure I understand the question. I mean, I will say, you know, being able to get even just plan review permits in different jurisdictions is challenging. Not everybody, again, it's very similar to restaurant inspections. There's different forms, they want different data. Maryland requires HACCP plans. Some jurisdictions require, you know, data that we don't necessarily have for other restaurants. I mean, I would love to see, I think it came up at CFP that there be some kind of like advisory or board that maybe reviews things like HACCP plans or process or procedures, that then if this board has approved it, that everybody then will accept the plan, and then locally they just evaluate, are they executing the plan, right? Because we all know there's the plan and then there's how well you execute it, right? So I can write a great plan. If my operators aren't executing it, it doesn't matter. Like, that's still obviously not meeting the intent. So I hopefully answered the question.
Yeah. Okay. I think so. Yeah, thanks. And then actually, let me squeeze in one last question for Michael. What kinds of technology do you currently use to manage your environmental health safety data? And what plans do you have for technology upgrades in the future?
So right now, our safety data is going to be basically our sterilization logs. So that's all done by hand right now. I'm working on a new system where it's going to be all available digitally. And then there's new sterilization machines that have been coming out recently that you can just plug a USB into and download a variety of sterilization data all from that. So that's kind of interesting, and it'll be available like on a cloud-based kind of system where you can look at it and track everything a lot more easily that way than right now using, you know, paper forms, which sometimes people forget to write in, or you know, user error with the wrong date or something like that. So yeah, the sterilization logs are definitely what we have planned to use right now, or we are using right now, what we plan to use in the future. And then customer data too. Like, customer data used to be all just on paper, and there was no tracking of anything. Whereas now, within the past, I'd say like 2 years, we started developing a system to do all of our customer data electronically. And there's a lot more that we can pull off something electronically than we were able to pull off the paper forms, you know, a lot quicker than we used to be able to do it. So digitizing all of the customer records has been a huge help in, you know, maintaining customer loyalty and tracking their interactions and that kind of stuff. So that's been a huge help, and I definitely see the future of that going all digitally for all customer data.
Fantastic. Becky, I know there's a question in the Q&A. Do we have time for that?
Unfortunately, we're out of time, so apologies if we didn't get to your question, but wanted to thank our speakers and panelists, Shelley, Nick, Scott, and Michael, and of course our moderator, Serene. Thank you so much for partnering today and bringing great content and discussion to today's webinar. We really appreciate all of your time. And to our audience, thank you so much for attending. Please complete the evaluation survey for today's webinar. As we're talking about data, we actually use this data, so please give us your feedback, comments, and recommendations for future learning opportunities such as this one. And we thank you all again very much and hope you enjoy the rest of your day.
Thank you, everyone.
Thanks, Serene.
Take care.
Thank you, everyone.